All right, welcome everybody. Thank you so much for joining us. Let me get all set up. Welcome. My name is David Martinez, director here at Vitalyst Health Foundation, overseeing our grants program and our civic health portfolio. Thank you so much for joining our monthly webinar that is the Spark partnership of Vitalyst Introduction. It is essentially a Vitalyst 101 webinar that we host every month. So folks that aren't familiar with Vitalyst or want to be reintroduced can learn more about how we operate as a foundation here in Arizona and our specific grant programming so you can begin to discover if there is alignment and what the steps are to access those grant partnership opportunities. I'm joined on the call today with by my colleague Michelle Goodthunder. She will be monitoring the chat as you have questions throughout the presentation. Feel free to utilize the chat room to put those questions in. And then at the end, I'll work with Michelle to get those recorded and then open it up for live Q&A as well. You all should be seeing my slide deck now. Michelle, can you give me a thumbs up or anybody give me a thumbs up if that's what you're seeing on the screen?
Yep, seeing it.
Perfect. Thank you so much. So we have accessibility measures. If you need Spanish, you can email conversemos@vitalysthealth.org. Utilize the closed captioning services available on Zoom. All lines are muted, and we ask that you keep yourself on mute until the end for the live Q&A session if you do have one of those. As I mentioned, Michelle will be covering the Zoom room for any questions that come up during the session, but we'll answer those live at the end. This recording, the slides, and all of the materials will be shared and posted at vitalysthealth.org's website, partnering with Vitalyst website, and shared with everybody that registered today. So for folks that don't know Vitalyst Health Foundation, we are a Phoenix-based and Arizona serving health foundation. We have a vision that all Arizonans are healthy and resilient, and we're on a mission to do that by connecting, supporting, and informing efforts that improve health of individuals and communities in Arizona. You'll see that kind of triad approach to our work, connect, support, and inform come up in a lot of different ways as I describe our work. We are based in Phoenix, but we have partnerships throughout the great state of Arizona. We have the opportunity to partner with efforts that are serving Arizonans throughout the state. So if you are not in the great state of Maricopa County, you can stay on the call. While we are a health foundation, we see health as more than just health care. We look at the broader social determinants of health, as is often said, or the social indicators of health. Many of you may have seen our elements of a healthy community wheel. We affectionately just call it the wheel, which helps frame how we approach health. We definitely see health as more than just health care, but obviously, as you see, access to care that spoke in this will is still a critical piece of being able to live a healthy life, and that's a big priority for us. But we are able to support entities that might be reflective in other spokes of this will. So as you begin to think through, am I mission aligned? Is there an alignment with Vitalyst opportunities to improve health with Vitalyst? If you see yourself on this will, then you are on the right track. If you don't see yourself on the wheel, that's okay because within each of these spokes of the wheel, there are a lot of different components where your specific projects or efforts might be more closely aligned. As I mentioned, Vitalyst works across this wheel, but we ensure that we have this cross-lens approach, especially around equity and resilience, and really work in the intersection in the middle of this wheel because there is an intersection between all of these elements of a healthy community will. So the first question, if you're exploring partnership with Vitalyst and you want to determine alignment, this is the first test. If you see yourself in this will, you are definitely improving health. As I mentioned, we like the number threes here at Vitalyst and me personally. So we implement our vision and our mission by working through three goals. Supporting collaborative networks, strengthening community partners, and informing decision makers. This is a really important aspect, especially on our priority side of the house, because Um, Vitalyst takes a upstream approach, as is often said in the public health space, to improving health. That upstream approach is tackling the root causes of the greatest health disparities in Arizona, rather than, say, a downstream approach, which is a bit more programmatic or direct service. I'll get more into this a little bit later as I'm describing systems change work. But that work is heavy work and takes a village. It takes a coalition, a collaborative of folks coming together. So in all aspects of our work, we support various different coalitions and collaboratives working to improve the conditions that impact health. At the same time, we also see that those collaborations are made up of individual partners that they themselves need to be strengthened. So we have efforts to strengthen community partners and ensure that they're equipped to especially advance health equity. And as I mentioned, our upstream approach is a bit more systems focused, which often involves policy and advocacy work. So we do a lot to ourselves to leverage our voice and support partners in informing decision makers that are to ensure that community health and well-being is prioritized in our communities and in our states. This is three goals that are represented in our programmatic priorities, or three programmatic priorities at Vitalyst. I like to say that Vitalyst has three sides of our house. Okay, what you're seeing on this slide is our more programmatic priority side of the house, and I'll take a deeper dive into that. The other side is our responsive and competitive grant making program that I'll describe more later. And then the third side of our house is our fiscal sponsorship program called the Technical Assistance Partnership of Arizona, or TAP-AZ, as you may know it. If you're interested in exploring TAP-AZ and better understanding what fiscal sponsorship means, the TAP-AZ team, our colleagues, have a similar monthly 101 for TAP-AZ specifically. If you go to tapaz.org, TAPAZ.org, you can enroll in that monthly webinar. A wide spectrum of information about the fiscal sponsorship and the services that that platform provides. Essentially, we are fiscally sponsoring about 70 entities across the state that either come under our 501(c)(3) status so that they could focus on their incredible mission in programmatic areas, or if they do have an existing 501(c)(3) status, then they can basically outsource their back office finance and accounting to us through fiscal agency and fiscal sponsorship. So if you want to explore more about that, go to tapaz.org. But coming back to the first side of our house, our three programmatic priorities. Every year, staff working with our community partners identifies priorities that we want to focus on more intensely that are key health drivers in Arizona. Our priorities for quite some time have been focused on civic health, healthcare integration, and housing. Each one of these portfolio areas is directed by an individual director at Vitalyst, and they each deploy strategies that are focused on each of our three goals: collaborative networks, strong community partners, and informed decision makers. So, for instance, our civic health portfolio is a priority area that I direct in collaboration with community partners. Our focus, again, is at the systems level for civic health. And by civic health, we mean a person's, an Arizonan's ability to engage in their community, to engage their community government, to tackle their toughest challenges and work to improve the health disparities in their communities. Those efforts are often inhibited or allowed based on certain rules that are set up. So we work specifically on the census, redistricting, and voting policies that really set the rules of the game and how Arizonans can engage in their community and in their government to improve health. The collaborative networks, remember that first goal we work with in this space, include One Arizona, a table of about 30 grassroots community-based organizations across the state that are strengthening civic health in each of those categories. As I mentioned, census, redistricting, and voting policies. We also support we also work to strengthen community partners, our second goal, including supporting the individual members of the One Arizona collaborative by partnering with an entity called Instituto that does a lot of capacity building for movement partners. And we do a lot of advocacy and public policy, a lot of informing decision makers about what civic health is and how any effort to change voting policies in Arizona may prohibit or disallow an Arizona's ability to let their voice be heard. Similarly, we have efforts in healthcare integration and housing. You'll see here a little bit of a greater description of each of those and my colleagues that oversee those portfolios. So my colleague Anna Rossetti, whose beautiful photos next to me, is oversees our healthcare integration approach. This portfolio is really focused on the integration of the physical, mental, and social determinants of health. So Anna has great experience in the health field and is bringing that expertise here to Vitalyst with community partners and supporting collaborative networks like the Cover Arizona Coalition, which is especially taking a lead role here in Arizona to ensure Arizonans can navigate our healthcare system, including Medicaid or access and the marketplace. At the same time, she's strengthening community partners that are working to improve health, especially around top public health issues in Arizona, like maternal and children's health and healthcare workforce. And Anna also takes the lead for Vitalyst in our efforts to inform decision makers and our own advocacy, and does a lot of advocacy work, a lot of informing decision makers on, especially, for instance, the coming cuts to Medicaid, to SNAP, which we're already seeing a lot of impact on here in Arizona. Our colleague Gabriel, who's next to Anna there, oversees our housing portfolio. This really is all framed around promising practices in housing and addressing the housing crisis that we're experiencing throughout the state. The collaborative networks that he supports in this space include the Arizona Housing Coalition, again, made up of really strong community partners that are scattered across the state of Arizona that are working to address that housing issue, especially critical workforce affordable housing. So Gabe is on the road a lot promoting our efforts to connect schools, churches, community health centers, other institutions like that with nonprofit affordable housing developers to address workforce housing throughout the state, including especially in rural communities. A lot of great work. That front also does a lot, includes a lot of advocacy work. So Gabe is often at the state capitol and in cities to advocate for housing policies, including state investments, government investments in our housing trust fund. And then the last fella on that page is our colleague Sergio Paris, who directs our strategic communications. He helps tell the story of Vitalyst and the impact that our great partners are making with our support. Because of his background, he also facilitates relationships with prospective partners for us in the spaces of food systems and the educational system. Those specific efforts aren't listed on here as key priorities for Vitalyst, but as I mentioned, and as I saw in the wheel, as you saw in the wheel, we can still discover partnership, explore partnership with mission-aligned entities that see themselves in the wheel working to improve health. So as you learn, we have our discovery intake process, as we call it, to discover partnership. And if you are an entity that is in those spaces, you'll have that conversation with Sergio. So we wanted to show his great smile on this slide as well. These are our three programmatic priorities, but if you are not working in these areas, you can still discover partnership with Vitalyst through our competitive grants program. So again, you don't have to be working just in these three spaces, civic health, healthcare, or housing, to be able to partner with Vitalyst. You would just do so through our competitive grants program, which is what I'll take a deeper dive in today. So our responsive grant making, again, the second side of our house, right? We have TAP AZ, the fiscal sponsorship, our programmatic priority areas of healthcare, housing, and civic health, and then our grant making portfolio, which is what we're taking a deeper dive in. In total, the Vitalyst Systems Change Grants Program is a 5-year grant potential for up to $225,000. We have three different grant categories that encompass those 5 years and the total grant potential: the Technical Assistance Grant, the Spark Grant, and the Systems Change Grant. Which grant you qualify for depends on where you're at in your journey towards systems change. Again, Vitalyst comprehensively takes an upstream approach to addressing the greatest health disparities in Arizona, trying to tackle those root causes. That's done through systems change. So our grants program is focused on supporting collaboratives working towards systems change. So as you are exploring alignment and partnership with Vitalyst, another good question to ask yourself is, are our efforts done in collaboration, done in systems change efforts? And if that is the case, there might be some alignment. If your efforts are more of the downstream interventions, providing direct service or programmatic work, very important work for sure, but not aligned with Vitalyst. So there's another kind of touch point for you to determine if there is alignment with Vitalyst grant partnership opportunities. So if you do see alignment already with Vitalyst, seeing yourself in the wheel as efforts to improve health, one of our three grant types, then you would go to vitalysthealth.org and complete what we call the discovery intake form. We created this really kind of easy intake form to be able to facilitate conversations a bit more thoroughly and strategically with partners across the state. We have an open door policy here at Vitalyst. So if you are interested in discovering partnership with us, you would just go to vitalysthealth.org, complete that discovery intake form on the grants and partnership webpage, and we'll receive that and review it. And if aligned, you'll be prompted to schedule a time to chat with us, a 30-minute virtual conversation initially to see if there is indeed alignment. That initial consultation call will happen with one of those four directors at Vitalyst, myself, Anna, Gabe, or Sergio, or even tagging in my colleague Michelle, who helps facilitate those introductory conversations as well. It's a quick 10-minute form that just collects high-level information about your entity, your collaborative, your potential system change effort, how you see yourself within that wheel, so that we can have a much thorough initial conversation to determine alignment and move forward from there. So now taking a deeper dive into each of our three grant types. The first tier of our three-tier grants program is our technical assistance grants. This is meant for collaborative capacity building. Again, all three of our grants have the same five grant criteria, excuse me. And this one is specifically mentioned for collaborative capacity building. So consider this a capacity building grant. It's a up to 1 year grant of up to $20,000 to help build up the capacity of collaboration to want to work towards systems change. That's a really important piece, because if you are just a collaborative for collaborative sake, really cool, really awesome, but that collaborative has to be working towards systems change in order to qualify for a Vitalyst grant. So in this instance, the technical assistance grant is at the very beginning. So your collaborative might barely be forming. In fact, you might just be one entity, a backbone organization that knows you want to work in system change and that you have to convene partners. So this grant can help leverage and support one lead applicant or one backbone organization, a 501c3 nonprofit or fiscally sponsored organization serving Arizona, to help bring those partners together, convene, and then build up the infrastructure, the capacity of that collaborative to then be in a better position to plan and implement systems change. That collaborative should for sure be working to improve health. We are a health foundation, so health outcomes is a criteria that we have. This is, again, alignment within the wheel, the visual you saw at the beginning of this slide deck. And as I mentioned, we won't just support collaboratives who are formed as a collaborative. That group has to be working towards systems change. So there's a systems change criteria for this. In this instance, because you're so early on in your system change effort, you don't have to have the specific interventions or solutions identified. But so long as you know that there is a system to be changed and you know the system that you want to indeed change. So you can be at the beginning steps of your journey towards systems change. We hold health equity, as I mentioned, at the center of our work. It's a key value for Vitalyst, and that's reflected in our grant programming as well. We want those closest to the problem, closest to the solution, especially as part of your collaborative. So we definitely value community lived experience of voices. We also want you to get as specific as possible with the health outcome that you're hoping to improve using as disaggregated data and cited sources as possible. So this is a connection between the health outcome criteria here as well. So we hold the health equity criteria to our grants, and then the budget has to be consistent with the proposed scope of work. So for the technical assistance grant, as I mentioned, it's up to 1 year, up to $20,000. I put up to 1 year and up to $20,000 because it really does, the technical assistance grant does go to a specific capacity building need of that collaborative. And sometimes that capacity building need is addressed over a shorter period of time, a smaller scope of work that might not take a full $20,000 grant. Maybe it's a 10 or 15K grant. So you can request up to $20,000. This is also can be utilized to support a consultant or coach, a facilitator often to help facilitate your collaborative, help you identify those core partners that are really instrumental in helping you influence and drive your systems change efforts. And usually in the technical assistance grants, if this is the case where you do need a consultant, we're happy to play a little bit of a matchmaker or put out a call for consultants to get you the best consultant to help do your work. They'll work collaboratively with you to think through the concept and draft their own scope of work that would be included in the proposal in addition to your written proposal for the technical assistance grant. So as I noted, we discover partnerships through our discovery intake form. To explore the technical assistance grant, you have to go through the discovery form. So if you're thinking, I think I'm really aligned with this one, go to vitalysthealth.org, the grants and partnership webpage, and complete that discovery intake form to begin this process. Once we receive it, there's alignment. You'll receive a prompt to schedule a time via Calendly to schedule with one of those Vitalyst directors that you saw. We'll have an initial review, and there might be some back and forth. If they do determine there is alignment to review a draft proposal, and once it gets to a strong point, they would invite you to submit that as the formal application. And again, if you have a consultant scope of work, you would include that as well. Um, as we receive these, we review them on a rolling basis. They do not have to be approved by our board, so we set up an internal review process where we review those and determine to fund or not. In this instance, we might have the team might have questions or feedback, so the director would then circle back with the team and be like, "Hey, can you clarify this in your proposal?" And then we'll review it again and determine if we should fund or not. And then as soon as we determine to fund, then we begin finalizing the grant, send you a grant letter for review and signatures so that you can receive your grant and begin your great work. So again, as I mentioned, these are reviewed throughout the year and do not have to be approved by our board, so there is no grant cycle. I will note a couple of things, especially as we're in now the fourth quarter of the FY 25-26. The real big deadlines that we're running against here are our fiscal year end, which is June 30th, and our own budget capacity. As you can imagine, as we get to the end of our fiscal year, we have more limited funding. However, we do have a good pipeline and capacity for technical assistance grants this fiscal year. And we will for sure continue with this grants program next fiscal year. So we would just continue those conversations into the new fiscal year if you're not quite yet ready for this. The next tier is our Spark grant. So again, the technical assistance grant is meant for collaborative capacity building. Then once you've done that, hopefully you're in a better position to advance to the next tier, which is our Spark grant. It is for collaboratives that are ready to do their planning towards systems change. So consider this a planning grant so that your collaborative can convene and plan the specific interventions or solutions towards systems change and that those activities are then sparked. That's why it's called the Spark grant. So this is a 1 year grant of $25,000, again, meant for those collaboratives that have been built. They just need some space and grace to do their planning. So think about strategic planning for the specific system change project. and beginning to think through what are the specific strategies and tactics that you have to achieve your systems change grant. You'll see here the same five grant criteria: collaborative, health outcome, systems change, health equity, and budget. Same five criteria, but you've advanced a little bit further in the continuum and in your journey towards systems change. So a little bit more meat on the bones with this. So for your collaborative, you have formed up more of your core partners needed to help advance your systems change. So you need at least two. We recommend at least three partners for this stage, but you might still be convening folks, identifying folks to invite in. So you can still be forming your collaborative, but it can't be just one entity as part of your collaborative anymore. It has to be at least two, but we recommend at least three. It's quality over quantity, as I always tell our prospective partners. So really think through who are those partners in the community that need to be at our table to help us really advance and our system change efforts. So think about that. A specific health outcome, getting a little bit more detailed and clarity on what is that specific health outcome you're hoping to achieve. Again, reflective in the will. The systems change criteria, again, a little further along this journey towards systems change. So you kind of know the system already and you're beginning to identify, okay, here are the specific players that are holding that problem in place, that are the barriers that are keeping that system in place. We need to specifically address them. And then during your Spark Grant planning phase, you're able to think through, here are the tactics that would help move them and make our system better. The health equity criteria is the same. We want you to continue to engage those community members with lived experiences and take an even deeper dive into disaggregated cited data connected with the health outcomes. So for instance, if your efforts are to improve diabetes rates in Arizona, that's really broad. To hold an health equity lens, you can look at data, disaggregated cited data, say, okay, the Black and African American communities in Arizona have the greatest disparities in diabetes rates here in Arizona. So we're going to focus on that. That would be an example. And then a budget. So again, a budget that's consistent with the proposed scope of work, 1 year grant for $25,000. Very similar to the technical assistance grant, you explore this through our discovery intake form. So if you see alignment with our Spark grant, you would go to vitalysthealth.org, our grants and partnership page, and complete that discovery form. We'll receive it, review it, and if aligned, you'll be prompted to schedule a time to chat with the Vitalyst director. Um, we review these. There might be, again, some back and forth between that director to help you get your proposal to a really strong position. And then they'll invite you to apply and submit via our online portal a formal application. Because these grants do have to be approved by our board, we have grant cycles throughout the year. So the next grant cycle, or what we're in now, is our spring grant cycle that closes on May 7th. So if you're seeing alignment with the Spark grant, complete that discovery form and we'll try to get you in before this deadline. We'll have another fall deadline, fall grant cycle, a winter, and then spring as we go into 2027. So don't feel like you have to rush to get into the May 7th. We can still have those initial discovery consultation calls with you and then just get you into the next quarter. And so that is the process for the Spark grant. Connected with this is just going back to the discovery form. Is the discovery form isn't the formal grant application. It's more of like the intake form to provide that kickstarts our discovering a partnership. The formal grant application comes through an invitation from a Vitalyst director for either a technical assistance grant, Spark grant, or the systems change grant based on those discovery calls. And then finally, we have the third tier, our systems change grant. So again, hopefully you've built your capacity as a collaborative using a technical assistance grant. You've done your planning for systems change using a Spark grant. Now you're in a better position to apply for the systems change grant, which is the implementation grant. So you've built your collaborative, you've planned your systems change. Now you just need to implement it. This is what the system change grant is for, an implementation grant. It's a grant that is meant for collaboratives that have formed. They are ready to implement their system change solutions. So you'll see here the five criteria, again, the same, but you're further along in your journey towards systems change. So you should be further along in the development of each of these criteria pieces. You for sure still have to be working towards a systems change effort, right? It's called a systems change grant. In this instance, you have already thought through the specific interventions and solutions towards systems change. Again, you're just needing to implement them. So your systems change project design is really well thought out and ready to be implemented. Similarly, your collaborative is really strong. The system change effort, like I said, is tough work. It takes a village, and your collaborative needs to be ready and prepared. You have to have the right partners at the table that will help influence and advance your system change work. So that's a really big criteria for us. You still have to be working to improve health outcomes, especially as seen through the elements of a healthy community wheel. And you still need to hold a health equity lens, continuing to engage those closest to the problem, closest to the solution, and now taking even a deeper dive and being very specific with disaggregated cited data for your health outcomes you're hoping to achieve. And then for this, the budget is a 3-year, excuse me, a 3-year budget of $175,000 to help you achieve your systems change. So it's $175,000 total over a 3-year time frame. Very similarly to the technical assistance and the Spark grants, we can have discovery calls to determine if this is aligned for your collaborative. I will say one caveat: we do allow any applicant, even those that don't go through the discovery intake form, to submit a system change grant application. So as you see here, we have a grant cycle in the fall that will reopen in the fall. And if you see alignment and you don't want to go through the discovery intake process to submit a system change grant application, you do not have to. However, we highly recommend it because we really do want you to see and ensure that there is alignment with the grant's criteria and that your efforts are especially done in a systems thinking approach. That's often the criteria that's mostly missed if folks don't go through our discovery call. And we don't want you to spend all this time writing our grant if there is no alignment up front and then ultimately get your application denied early on. So we highly recommend going through the discovery intake process, but you don't have to for the system change grant only. So very similarly to the others, if you do go through discovery, or I'll say when you go through discovery, we'll review it. You'll be prompted to schedule a time to chat with the Vitalyst director. They might provide feedback again on your draft proposal. This proposal is 5 pages along with a budget spreadsheet. The 5 pages reviews those 5 criteria pieces, and then you'll submit that by the deadline. Once we pass our deadline, we do an initial review of all the applications and then advance those that meet the baseline criteria to a review of our grant review committee of Vitalyst. This includes Vitalyst team members and some members of our board of trustees. They do a review of the written applications, and then based on those reviews, we do a scoring based on evaluation rubric that we share. We have an again open door, an open book with our application, so you'll see that evaluation rubric, but it's really hitting those 5 criteria pieces. And we submit our scores for the written application. Staff then does an analysis of that data and selects semi-finalists to invite for the presentation stage of the Systems Change Grants cycle. So semi-finalists are invited to present their proposal to the Vitalyst Grant Review team, again made up of team members and trustees, for a 30-minute virtual presentation. This is a mechanism that Vitalyst uses to practice what we call equitable grant making. So We work with a lot of grassroots community-based organizations who may not have a full-time development officer or fundraiser or grant writer. So their written application may not be as strong, certainly strong enough to get them to the presentation phase, but they sure can tell their story well. So the presentation phase allows those more grassroots community-based organizations to tell their story in a different way, in a stronger way, perhaps, and we do a separate review of the presentations with a separate rubric that will also be made public. So we scored the written application, then we scored the presentation for that equity practice. And then the staff at Vitalyst compiles and analyzes that data and then recommends which ultimate finalist to fund for our Vitalyst Systems Change grants. These do require board approval. So we have the system change grant set on an annual grant cycle. Because it's a higher amount, it's a little bit of a more thorough grant process, which is why we have this annual grant cycle that has passed for this fiscal year, but will reopen in the late summer, fall. If you're interested in the alignment with the systems change grant, please still today complete a discovery intake form because we can begin those conversations. We'll just get you teed up to be in a better position to submit the application once that cycle opens in the fall. So I've been talking about this criteria about systems change, and you're just like, okay, what the heck does this systems change mean? How is it different than the downstream programmatic or direct service interventions? During the new fiscal year, which again for us starts July 1, as we reopen our grant cycles, we will conduct a specific webinar just on what systems change is and how folks can really see themselves in and find alignment with systems change. This is just an initial visual that we use to help frame how we see systems change and hopefully help you better understand systems change and see if there is alignment with your efforts. So there are 6 conditions of systems change. And if you go to vitalysthealth.org, we have a whole web page with a bunch of resources, including this visual white paper or Spark report that we drafted with partners on systems change, webinars, podcasts, a bunch of other resources to help you think through, am I actually working in systems change? Do I meet this criteria? A big piece of what we hope to build understanding for and alignment as part of our grants. So there are a lot of different approaches and conditions to change within the larger systems change. And you see these reflected in 6 ways in this inverted pyramid. So on this top tier here, you see the more explicit or the more easy to see conditions of systems change. So for instance, policies and practices, right? Those are easy to see as systems change because you see something tangible, like, right? So like pass like House Bill 1 or repeal this state ordinance or whatever it is, right? That's a really tangible, easy to see systems change. It's when you get down to the relational change and the transformative change levels that it makes it more difficult to see a system change. But we have funded in the past, and we will still discover partnerships with entities that are trying to change those conditions. So relationships and connections, power dynamics, those critical pieces and conditions that are needed to, again, make the overall system change. And then, of course, the most difficult to see is mental models, changing hearts and minds. It's really hard to define and see that, but a really critical piece to the overall systems change effort. A perfect example I get of a transformative systems change that has really met all 6 of these conditions is drunk driving. At one point, believe it or not, and some of you might remember on the call, it was not illegal to drink and drive. And so there were policies that were changed to change that. So in this case, entities like Mothers Against Drunk Driver formed a collaborative trying to change the system, right? So they changed the laws. They ensured that law enforcement had practices in place to test and whatnot. They changed some resource flows. They built these relationships and connections. They changed the power dynamics in these approaches. And because of their very robust public awareness campaigns, began to change hearts and minds, changing mental models around the concept of drunk driving. So even though it's still done, unfortunately, around the country, it's a lot less, and there are stiffer penalties for doing that. So that's Broad overview of Vitalyst Health Foundation. Again, how we operate as a foundation and the three sides of our house. The fiscal sponsorship program, TAP AZ, our programmatic priorities in housing, healthcare, and civic health, and then our competitive grant making program around supporting collaborative capacity building, planning, and implementation towards systems change. So, Michelle, I'll open it up now for questions that you may have addressed in the chat room before we open it up for live Q&A.
Yeah, we just had one question that came into me. It was, do applicants need to have previously received a technical assistant grant to be eligible for Spark grant? And I said, no, the continuum, so the system change continuum can support collaboratives along the way, but a collaborative can jump in at any point depending on what their activities look like. And if you want to elaborate, you're more than welcome to.
Yeah, absolutely. And apologies for missing that point. Yeah, you do not have to start at square one. You do not have to start at the technical assistance grant. So if it's discovered that, yeah, you've built your capacity in your collaborative, you're ready to do planning, jump straight to the Spark grant. And then if you've already done your planning, you're just ready to implement, then jump straight to the systems change grant. So you don't have to start at square one or even square two to jump to square three. So you would go through what you would go through the process for whichever you find alignment with. I will also note that if you do start with the technical assistance grant and you finish that up and you are interested in the Spark grant, you still have to apply for the Spark grant. So you still go through our discovery process and discover if you're ready for that. And then if you get your Spark grant and then close that out and you're ready for the implementation, the system change grant, you would still have to apply for that one. So it's not a guarantee. They're still individually competitive. All right. That was the only question from the Zoom room. Are there any questions that folks have for live Q&A? Feel free to raise your hand or unmute yourself and we can be in dialogue with each other.
I actually do have a question.
Yeah, go for it, Clarissa.
And so I kind of chimed in a little bit later, but I do want to ask when it comes to the Spark grant, if I'm not mistaken, I believe it's something that's more like a seed grant, and I just wanted clarity on any process if it does prove to be successful, if there is funding towards that seed grant, what it would look like for it to become something that would be like reoccurring. Is there any options for it to be that eventually, like starting off with that seed funding? And then it becoming something that is reoccurring funding.
Yeah, it wouldn't necessarily be reoccurring funding because we really do want you to advance in this continuum towards system change and eventually move to the implementation phase.
Mm,
Um, And systems change work is very project oriented.
mm.
So when you start using words like reoccurring or sustainable funding is needed, it's probably not a systems change effort. It's probably a more downstream intervention, which again we don't kind of disregard. Very needed in our overall efforts. But Vitalist grant opportunities are geared specifically to support collaboratives working towards systems change. So very project oriented, usually time confined. Of course, change happens within systems change efforts for a lot of different reasons. So that whole trajectory might change and your timeline might change. We also recognize that, I threw up that slide reflecting the six conditions. You don't have to tackle all six, right? Especially thinking about 5-year grants of up to $225,000. The true transformative system change when you're hitting all six of those takes many years. Think about that MAD example, right? Like that was decades and decades in the works, right? So yeah, years and years and years. So our grant is really to help you make strong advancements towards your systems change. Usually confined project system change efforts. I also, so you don't have to hit all six. You can for sure hit at least one, maybe two or three as you see fit, and the specific activities or interventions you have to change that condition. Um, we recognize, that the Vitalist grant is limited in time, limited in resource. You will need much more resource to achieve your overall system change. We're just one piece of the puzzle for you.
Okay, thank you for that. I appreciate
Yeah.
the clarification.
One thing I'll also add, Clarissa, and for the team here is uh, if you're in the Spark grant phase or even maybe in the systems change phase, you might still like need to build up the capacity of your collaborative or address a or troubleshoot a challenge you're having with your collaborative. Coalition work, as I'm sure many of you can attest, is really challenging, right? So we can go back and leverage and explore maybe adding a technical assistance grant to help you tackle a specific capacity building need you have for your collaborative. We do like to try to have you focus, especially if you have limited capacity on that particular grant. But we have a pretty open door policy. We as we onboard partners, we have an open door. We have an open door policy. We have regular check-ins with our partners to ensure that any challenges that you are experiencing with your collaborative and implementing our systems change, we can work together to address.
Okay, thank you. That sounds good. So basically, although it's not something that would be reoccurring or continuously invested in year after year, you would do the check-ins and you're able to add technical assistance or specific capacity building outside of that technical assistance.
We would certainly be able to explore that. But again, we would really evaluate, okay, what is the specific capacity building need? Where are you at in your planning or in your implementation to see if that is indeed the best utilization of the funds. We have limited budget capacity for our grants as well, so we kind of want to spread the love a bit and make the biggest bang with our bucks.
Okay, thank you, David.
Mhm. Any other questions for this live Q&A? Feel free to raise your hand or unmute yourself to ask. Well, hearing none and seeing no hands raised, I won't have you linger longer for more than needed. But know that if you do have any questions, don't hesitate to reach out to us. You'll again receive this recording, the slide deck, and accompanying materials in a follow-up email for all those that registered for this webinar. It'll be posted to vitalysthealth.org and our Partnering with Vitalyst webpage. If you do see alignment with one of our grant types, feel free to go to vitalysthealth.org and complete that discovery intake form. We look forward to discovering potential partnership with you. Thanks for participating in this month's Vitalyst 101.
Thank you. Bye.